side effect profile of therapies for patients with thyroid cancer. It's a very important issue because many patients, even when they have radioiodine refractory differentiated thyroid cancer, will have a low burden of disease from which they're asymptomatic and can grow rather slowly. Those patients may not need a therapy right now. And that's why in the eligibility criteria, patients had to have disease progression at the time of study entry. And then what we saw in the progression-free survival curves in patients on placebo, that the progression-free survival of the patients on placebo was 3.6 months. So that represents the fact that patients that were enrolled on the trial did have bad thyroid cancer that was progressive over a short period of time. These are patients who get sick from their thyroid cancer and will go on and die from their thyroid cancer. So that's the patient population that was studied in this SELECT trial. That's a patient population that needs effective therapy. Unfortunately, in oncology as a whole right now, our oncology drugs do come at a cost of some side effects. And we do see side effects with lenvatinib, which are very similar to the side effects that we see with other VEGFR multikinase inhibitors. Hypertension is common, diarrhea is common, decreased appetite, weight loss, rash. We're seeing frequently in patients on the SELECT trial. Most of the toxicities seen were grade 1 and grade 2. Toxicities were manageable with dose holds and dose reductions, also very active symptom management and supportive care. So, and then you asked about the 6 treatment-associated deaths that were seen on the study. 2 of the deaths were due to known toxicities of this class of drugs. 1 patient died of a hemorrhagic stroke, 1 patient died of a pulmonary embolism. Those may indeed have been related to lenvatinib. The other 4 patients were deemed to have died due to generalized deterioration in their health. I think it's difficult for us to know, without knowing more details that may never be known, whether those patients had progressive disease that might have been in part responsible for their death and not death only due to unexplained toxicity from lenvatinib. So the other thing I think that's important to keep in mind is that patients on the study did die of thyroid cancer. I believe that while the median overall survival has not yet been met, there were approximately 35% of patients on the placebo arm who died due to thyroid cancer. So we have to keep in mind that patients are dying of thyroid cancer. So unfortunately there were, I think, a couple of treatment-related deaths that were seen on the study, but in the context of the patient population, it's something that we see with effective oncology drugs.